over what a concept map is, or what we're looking for clinical concept maps on our patients. The reason we're going to be asking you to make a concept map between each clinical day is because it helps you sort of visualize the patient as a whole with all their medical diagnoses, conditions, treatments. It kind of takes the nursing process and applies it to your specific patient. And then it's sort of in a nice map or picture that makes sense to you. So a good way to start is in the center of your map, kind of picking or writing down your patient's primary medical diagnosis. So for example, pneumonia. And then I also like to write the patient's age and gender, just to kind of help keep that in front of mind in case it applies to the situation. So having that kind of at the center kind of helps you with a place to start and a kind of a place to branch off of. And we like to think about this in sort of levels. So the next level would be nursing priorities, or sometimes we refer to them as nursing diagnoses, or problem statements, or priorities. So for example, pneumonia, we might think of impaired gas exchange. And how you verbalize that or communicate that on your form, if you use different terms, that will be okay too. This is a nursing diagnosis technical statement, but it doesn't have to be. It can just be sort of an overarching statement that describes the problem that you're thinking about. The next level under our problem statement or nursing diagnosis or priority statement is you can call it or think of it as your assessment data, but basically what evidence supports this. So in this instance, we might be talking about their O2 sats. We might be talking about supplemental oxygen that they're on. Maybe they're on 3 liters nasal prom right now, and normally they're not. You might be thinking about their chest assessment, and you could be as specific here as you want, so talking about coarse crackles to bases, etc. You can also include here any diagnostics that you might be looking at. So you might be looking at, for example, a venous blood gas for this patient. Maybe that was taken when they were admitted. You might likely be looking at chest x-rays. And again, not reading them necessarily or looking at them right away, but when you're reviewing the chart, these are things you're gonna maybe wanna consider with this patient. So the kind of final outward rung is going to be our treatments or interventions, or you might think of that as medications, and that's a big part of that too. So we can talk about the medications. So for this particular problem, the patient might be on levofloxacin. For the specific treatment of their pneumonia, their infection, oxygen technically is a med, so that's supplemental O2 that we're giving them. The other treatments for this patient, maybe they're on puffers or nebulizers to help with their breathing. And you want to list specifically which ones. And then again, how much detail you get into here is sort of up to you, but it's a good idea to sort of list some of the common side effects of the medications or indications, contraindications, so that you can link them possibly to other conditions as you get into them with this particular patient. So that's kind of the different levels that we're looking at with the concept map. And you can kind of box them off so it stays hopefully like a little bit more organized on your page. And then most people, especially in the adult population and older adult population, tend to have multiple comorbidities. So let's say, for example, this patient who's here with pneumonia also has type 2 diabetes. So we want to consider, again, kind of can branch off from our primary diagnosis to a nursing priority, nursing concern, nursing diagnosis, however you want to call it. But we can talk about possibly impaired glucose regulation. And then, again, same principles, kind of same pattern. We're going to list our evidence that supports this, or the nursing assessments and or the diagnostics that we're going to be looking at to support this, and and or monitor this. So pretty obvious, we're going to be looking at their blood glucose levels. We might be looking at a hemoglobin A1C to see what their trends have been. We're going to be monitoring their PO intake, that kind of thing. So, and again, you could branch off of both of these a lot more. So for pneumonia, another possible priority could be activity intolerance. That because they're having this shortness of breath, they're not able to move around as much as they would, etc. And then that might in turn affect their diabetes. So seeing kind of at the end how things link together. And then again for diabetes, we're going to list their treatments and or interventions. So we can do a branch coming off of this. And maybe they're taking metformin and insulin. And maybe we're having to consult the diabetic education team because this person identifies that they need help or more information about their diabetes and so on. So at the end, you're going to kind of want to come back and link things together and add more and more information. But that's sort of the basics and the breakdown of the concept map.